A tracheostomy is a surgical opening in the windpipe, or trachea, at the front of the neck. It creates a direct airway, bypassing the mouth and nose, making breathing easier for those in critical condition. A tracheostomy tube, or trach, is placed in this opening to keep the airway open. Doctors recommend tracheostomy for patients needing long-term ventilation, or when there's a blockage in the upper airway from injury, tumor, or swelling. It's also used when patients can't clear lung secretions, as in pneumonia or neuromuscular disease. The trach allows for easier suctioning and reduces infection risk. For some, it's a bridge to recovery. For others, a long-term solution. It can make weaning off a ventilator easier and may allow patients to speak or eat. The goal is always to secure a stable airway and improve quality of life. Understanding these reasons is essential for any future doctor. Preparation starts with informed consent and careful positioning of the patient. The neck is cleaned and anesthesia is given so the patient feels no pain. The surgeon makes a small incision below the Adam's apple, exposing the trachea. Precision is key to avoid nearby blood vessels and the thyroid. The team monitors vital signs throughout. The surgeon creates an opening in the trachea, and the anesthesiologist coordinates the transition from the mouth tube to the trach tube. The trach tube is inserted and its cuff is inflated to seal the airway. The tube is secured with ties and a sterile dressing is applied. The procedure ends with close monitoring as the patient wakes up. Teamwork and communication are crucial at every step. Safety starts with a surgical timeout confirming the right patient, procedure, and site. The team reviews medical history, allergies, and ensures all equipment is ready, including various trach tube sizes. Continuous monitoring of heart rhythm, oxygen, and carbon dioxide is essential. The anesthesiologist and surgeon communicate constantly to keep the patient stable. When the trachea is opened, the mouth tube is pulled back just enough to allow safe placement of the trach tube. Once in, breath sounds and carbon dioxide levels confirm correct placement. Securing the tube is vital. Accidental removal can be life-threatening. The team is always prepared for emergencies like bleeding or airway loss. Clear plans and experienced teamwork make all the difference. Vigilance and communication are the foundation of safe tracheostomy care. After surgery, the first 24-48 hours are critical for monitoring complications like bleeding, infection, or tube dislodgement. Regularly check the stoma for redness, swelling, or discharge, and ensure the tube is secure. Tracheostomy care centers on suctioning mucus, cleaning the stoma, and managing cuff pressure. Use sterile technique to prevent infection and check cuff pressure to avoid airway damage or leaks. As a future doctor, you must teach patients and families how to care for the trach at home. Use clear language, demonstrate procedures, and provide written instructions. Empower families to recognize problems and know when to seek help. Master the basics: sterile technique, emergency protocols, and patient education. Compassion and communication are as important as technical skill. Remember, your empathy can make a world of difference in a patient's recovery. That's what defines a truly great physician.